Hello, everyone, and welcome to today's webinar, Trends in ePrescribing Regulation and Legislation. My name is Melissa Bundy, and I am Point of Care Partners Lead of Marketing and Regulatory Resource Center. Today's webinar is a part of a series we offer each quarter where we summarize the latest and most pressing regulatory trends and activities that we see through our day-to-day monitoring. I do want to mention that we have a change in speakers today. Derek Pike will be presenting in place of Mike Berger due to unforeseen conflicts. Before I go over our agenda and introduce our speakers, I'd like to go over a few housekeeping items. So first of all, you'll probably have already noticed, everyone is muted during the webinar, but feel free to send questions anytime. You can use the question area in your control panel. It'll literally say questions, and you just have to maximize that area in order to type in your question, and everyone will see those. If you don't see the question pane, you may need to click on the little orange arrow to expand the control panel. Also, if you're having any issues with audio and you need to switch to phone, click on audio and then select telephone, and it'll provide the dial-in information with the pin that you can use to dial in. When the webinar ends, a brief survey will appear on your screen. We'd love to get your feedback so we can make sure that these quarterly webinars are conveying helpful information. And we do have a handful of interactive polls during the presentation, and we hope you'll participate in those so we can kind of learn from each other. This session is being recorded, and we will send out the recording to all registrants after the presentation. And for those of you just joining us, welcome. So here are some things that we're going to cover in today's session. We're going to highlight some major federal and state legislation and their impact. We'll take a high-level overview of regulations specific to ePrescribing and long-term post-acute care settings. We'll review some trends that will impact EHR design most, and then we'll make some predictions just based on what we're seeing, legislation that's pending, that kind of thing. So now we will kick off our webinar with an interactive poll. We just want to know how you're staying on top of state regulations currently, or if you feel like you're doing a good job of it. I know it's difficult to keep track of all of the different areas to find information and make sure that you're as up to date as possible. So it looks like the majority of you are saying that you're sort of staying on top of things, and that's not surprising at all. We hear that a lot. So next, I'm going to hand it over to our speakers so they can introduce ourselves. We've got Michelle Sobel, who is our co-editor of the Law Review, and then also Derek Pike, who is a consultant and account manager for Regulatory Resource Center. So Michelle, you want to introduce yourself first?
Sure. Good morning, everyone. I am the co-editor of Point of Care Partners Regulatory Resource Center. I am a pharmacist, and I've been evaluating ePrescribing laws and regulations for over 10 years. I've seen lots of changes over the years. I know the laws and rules are very complex, and they're always subject to interpretation. I can tell you from experience, it requires dedicated resources to understand, interpret, and then implement the specifics around the different state nuances. Now I'd like to introduce you to Derek, who will be my co-presenter today.
Hello, everyone, and a happy Tuesday to you. And let me just say thanks for taking out some time of your day to be on our webinar. We really appreciate that, and we hope it's as informational as it can be for you guys for taking your time. In my role, I'm the consultant and an account manager for our Regulatory Resource Center here at Point of Care Partners. My involvement with pharmacy regulations is kind of unique. I spent a good bit of my career in the pharma area, but in addition to that, for about 6 years, I was the executive vice president for the Florida Society of Health System Pharmacists. And it was based in Tallahassee, which is the capital of Florida. And I actually got a chance to work with some legislators on developing some pharmacy regulations. And it's exactly like you hear. It's like sausage. You may like it, but you don't want to see it being made. That's kind of the feeling I had with that. And then the other side of the coin was I spent 5-6 years with Syncor, which was a nuclear pharmacy company. And in my role, I had to audit 13 of our facilities in Florida. So I actually looked at the regulations and the policies and procedures we had to follow, and I would do surprise visits myself and surprise audits just to make sure that we were following all the guidelines. So kind of a unique perspective on the regulatory situation there. And so it's kind of a hand in glove type of thing for me now to be working on the Regulatory Resource Center.
Let's jump into who governs the prescribing process. There are many agencies that have oversight and responsibility on how prescriptions are written and electronically delivered. The primary overseer of prescription regulations and rules typically is the Board of Pharmacy. However, we've seen a lot of collaboration with the boards of medicine and nursing, especially around the emphasis on opioid and other controlled substance prescriptions. The DEA only regulates controlled substance prescriptions at the federal level. However, some states have their own controlled substance agencies and Bureau of Narcotics for controlled substance management. As we know, this adds a layer of complexity as you have many agencies mandating their own controlled substance schedules. Some of these coincide with the federal level, but many times not. So how do you stay compliant if you do this on your own? I would make sure I was reviewing all the boards of pharmacy and all the other agencies. Other areas may publish clarifications that come from multiple locations. And it's not really easy to find. You might find things in a newsletter or board of meeting minutes, letters to licensees, things hidden on Board of Pharmacy websites. The result really is several rules and regulations that are difficult to find. You have to sift through them and sometimes even understand. Derek, perhaps you can tell us based on past experience how prescribers stay on top of regulations.
Sure thing, Michelle. As tough as it is to track all of these regulations, it's even more challenging for providers. And I'm sure all of you know, there are just so many variables. And many times providers will try to interpret the rules themselves, typically get themselves into trouble. They may turn to colleagues for advice, which is not always a very good idea. And many times it just kind of leads to misinterpretation. So I know Mike Berger was supposed to be on this call, but Mike shared with me during his time as an EHR product manager that he got a call one time from a physician client, and they had an inspector from the State Board of Pharmacy in his office at that moment. The inspector had ended up there because he was auditing a local pharmacy, found many prescriptions from this particular physician that were out of compliance. The inspector visited the physician, just showed up at his door, threatened him with fines and suspension of his license for illegal prescribing. That's a terrible situation to find yourself in. As it turned out, though, after some investigation, the physician was transmitting prescriptions for controlled substances to the pharmacy, but he wasn't credentialed or enrolled in ePCS. Now, he said he knew that ePCS was legal in Ohio, but when the EHR didn't allow him to transmit controlled substances, he just went into the drug file and changed the schedule of controlled drugs so he could transmit them. And you probably are all like going, wow. Yeah, we were going, wow, as well. Anyway, he knew how to do this, again, because he had checked in with a buddy across town, and the buddy told him how to get around that. I think we call that a workaround. In this case, it's a bad workaround. So the end of the story, fortunately for the physician, this was well before there was such a focus on the opioid crisis that we have today. Mike told me that him and his team were able to remedy the problem pretty quickly and without any penalty to the physician. And so, fortunately that Mike was the product manager at that time for his EHR, had a good handle on what these legal requirements were, and was confident from a system perspective that he had the tools to fix this and for his clients to be compliant. Interesting story, right, Michelle?
It sure is. As we go into the risks of non-compliant prescribing, here are some key ones. While your customers, typically the prescriber, should know the regulations and they are ultimately responsible for compliance, many expect their EHR vendor to help ensure they are compliant. What happens when you're missing functionality to ensure compliance? Well, we all know what happens. You have an unhappy customer. which could also be compounded by penalties and fines for your prescribers. And then your staff has to respond by researching the regulation, evaluating where the gap is, and then you have to schedule emergency patches so your customers are in compliance. Lastly, not making regulations as part of your product enhancement causes you to divert time and resources away from new functionality planning, implementation, or testing that could make your product easier to use while you react to the missed regulation. So Derek, I know you've worked with customers in the EHR space. How do they stay up on regulations?
Well, a number of our clients, they have expressed similar type of issues that come across their desk from their support team, maybe being told their product didn't meet a regulatory requirement. And when that happens, we've all done this before, the fire drill ensues. It's like it's a crazy time, chickens running around, their heads cut off, struggle to find out and understand what even the issue is, figure out how they're going to fix it, and then rush to put a hot fix out. Situations that you just do not want to be in.
So it sounds like the stakes are getting even higher as we're seeing new mandates that directly impact EHRs and have penalties for non-compliant prescribers. Perhaps you could share with us how costly a mixed regulation can be for an EHR vendor.
Well, what we have done is we tried to take some of this hot fix fire drill and put some estimated cost around it. And what we kind of came up with was a look at help desk calls and what does that entail. And we just looked at one call per month for each customer. We're figuring that there's a 1%, maybe 5% related to missed regulatory issues. And then again, each regulatory call requires about 3 hours of staff time for some call time, triage, research, whatever it might be. And we just put a conservative number on that, about $18,000. Now we move into the hot fixes where we've kind of gathered our information. Now we got to figure out what to do about it. Now we're pulling in the product management team, development team, some Q&A. How do we get this distributed out? The installation cost of that. And we figure on each hot fix is about 5 hours per customer, and just another estimated conservative number, about $50,000. And this is the part that's really, I want people to focus on this. These intangible costs, particularly customer satisfaction. Now, I am involved with some communication skills on dissatisfied customers. We have a statistic we use that one dissatisfied customer will tell 11 people. Of those 11 people, they will tell 5. And what that works out to is about 67 people in a short time frame that knows about one person's dissatisfaction. Hard to put a cost on that. But again, physicians are legally liable for their prescriptions, as you know, and if their software is not current, the vendors, us, risk of customer dissatisfaction and possible loss. So there's an opportunity cost that's unknown. You know, the EHR staff's not involved in hot fixes, and they could be allocating their time to maybe other stuff that's a little more revenue generating. We don't know what that cost is, but I think conservatively we can say it's somewhere probably between $80,000 and $100,000 just for these types of incidences that we hope never happen.
As an EHR vendor, when you're proactive in planning for product enhancements, your prescribers are happy and your customers are confident they chose the right vendor for their office and staff. We all know that there are many EHR products on the market. Your customer has many choices, so you want to ensure that you're staying on top of regulations, planning for them, and ensuring your prescribers are in compliance. They depend on you to help them meet all the requirements. So Derek, as an account manager, you talk to all kinds of companies who need to stay on top of the changing regulations and legislation. Can you tell us what are some of the challenges they express when tracking regulations?
Well, Michelle, I would say that just the sheer number is probably one of the most common challenges I hear about. they think they have a handle on tracking regulatory changes, and then something comes up that kind of slaps them in the back of the head, and they realize, uh-oh, kind of missed that. Now, many times they've assigned that responsibility to the product manager or some other team member, but that team member has a lot of other duties to handle as well. So it's just the case of juggling too much, spinning plates everywhere, and then potentially what happens is a law gets passed with a tight deadline and it falls right through the cracks. And we know this happened back in January, where the state of California implemented a new regulation, and they gave everyone a whopping 2 weeks to comply with that. And I think everybody understands how Ohio is notorious for passing laws that have extremely aggressive deadlines. And what normally happens is that when a deadline is missed, we end up getting a call back because they realize they need more tools and support to stay on top of everything. And that's what we like to do. I mean, we feel good about our role in that to our customers. We want to be that security blanket so that they know they have an additional set of eyes and expert researchers that are keeping them out of the ditches on each side, keeping them in the middle of the road. So our customers know that nothing causes a lack of confidence in your EHR product more than when a customer is the one to notice that an EHR isn't compliant and that the healthcare provider actually is the one that might be fined. So to me, there's a number of benefits that are an up-to-date compliant system would keep someone out of trouble, and not the least of which is avoiding the type of phone calls that, again, none of us want to get from our customers. So Melissa, at this point, I think we're lined up for another poll question.
Yes, we are. So basically, we're asking, in the last 2 years, has your company had to roll out a patch or a hot fix in order to comply with an enacted regulation or rule? So it looks like we're about 50-50.
Well, let's take a look at some of the regulatory trends we're seeing. We've conservatively estimated there are approximately 500 laws, regulations, and rules in place across the country with which you need to comply, not to mention the details within each of these 500. There are over 100 regulations and rules just on who can prescribe, what they can prescribe, and then how much. Add in the rise of mid-level prescribers, podiatrists, and dentists, and this becomes a challenge to manage if you have a variety of different prescribers using your system. While we all agree and understand it is their responsibility to comply with the laws, your clients expect you to program some of this information into your electronic health record.
Michelle, just for an example, just in 2019, year to date, we have monitored over 375 pieces of legislation at the state and federal level. Now, not all these bills get enacted, and so far only, quote unquote, 96 have been enacted, while 47 fell due to some other reason like session adjournment or a merger with other bills, or maybe they were just flat out defeated. But that still leaves about 130 or so still working their way through the legislative process. Here's the question for the group today. Is your team able to keep up with this much legislative activity? I mean, that's quite the question, and that's feedback I'd like to hear back from our customer base and our potential customers as we discuss that with them. I mean, you may think that the printed prescription is a thing of the past, but you still need to have all the functionality available to print a prescription if there is a system outage or maybe there's a patient without an exemption. You have to ensure that those printed prescriptions are in the state-specific format. Ohio, again, just recently changed their requirements for printed prescriptions to accommodate the ICD-10 requirement. So prescription requirements and rules for electronic transmission change every day. We're seeing regulations around mandatory electronic transmission regulations requiring controlled substances via EPCS functionality, or in some cases, even for all prescriptions. So the federal regulations, and the legislative regulations are sometimes the drivers for all this state activity.
Let's take a look at the recent federal legislative and regulatory activity, keeping in mind that sometimes specific federal programs like Medicare Part D can be a major driver for other programs and payers, including private commercial applications. Last year's Federal Support Act, H.R. 6, contained many subjects and approaches to combat the opioid crisis, many of which are important but out of scope for immediate purposes. However, note that prescribers who treat Medicare Part D patients, specific sections in this law exist that for covered Part D drugs, there is a mandate for e-prescribing of controlled substances and a mandate for electronic prior authorization submissions and responses. Last year, CMS announced flexibilities in the Medicare Part D prescribing rules, referenced as the indications-based formulary design. It permits Part D plans to place coverage issues specific drugs based on the use of the drug. So a focus on diagnosis or reason for use on many drugs may be required on more prescriptions. Point of Care Partners believes it's reasonable. In fact, it's common and expected to see states create complementary legislation and regulations that could apply similar requirements to non-Part D members like Medicaid and even commercial plans. No better example is in the areas of EPCS. Although some states had already passed EPCS laws by the time the Support Act passed, we now have 28 states that have some sort of EPCS legislation in place. While it's possible a state or two may do nothing in this area and make only Part D controlled substances be e-prescribed, the reality is some states mandate e-prescribing for all prescriptions. But in each case, exceptions exist that also vary by state. Point of Care is monitoring the activity on the other items noted above that are still in proposed status. If and when adopted and enacted, we'll comment further. Let's move on to see what we're seeing in the state activity.
Thanks, Michelle. You know, building on this federal legislation, you can see that states are very busy this year addressing very similar subjects. So if you look at the number of states that are limiting controlled substances prescribing, especially with opioids, mandating EPCS, 28 states so far, delving into electronic prior authorization requirements, which is 32 states, and or requiring PDMP use prior to prescribing and or dispensing at least some controlled substances, that's 44 states. These numbers are truly outstanding. Now, again, there's 44 states who have at least one drug that is not a federally controlled substance, that they have either classified as controlled within their state or they've mandated that certain non-DEA controlled drugs must be reported in their state PDMP. So you can clearly see that these states have been busy trying to get controlled substances in this situation under control. In fact, we're currently monitoring more 2019 legislation and regulation that suggests over 30 states proposed activity in controlled substance limitations, and these are additional limits and or modifying existing ones. And that's in addition to overlapping with the 37 states reported on this slide with existing laws in this area. Almost 2 in 5 states have had or still in proposal around electronic prescribing of controlled substances, many of which are now included in the 28 with the existing laws on the books. 1 in 5 states have had prior authorization activity. In fact, electronic PA is now a standard for which the adoption rate is rather low on the prescriber side. But Point of Care Partners see some parallel here on how electronically prescribed controlled substances came to be. Slow out of the gate, but it's now picking up steam since there are regulations and rules mandating it in some sectors, particularly like Part D. So picking up on the 44 PDMP query mandates, there are a lot of challenges with integration into the EHR systems. I want to mention one quick thing too about a technology success story that we have. And this is making a difference in the opioid crisis in prescription drug monitoring programs. So PDMPs have made a dent in the problem. Every state has one except Missouri. Many states have adopted the rules to encourage prescribers to check the PDMP before even prescribing opioids. Recently, there was a study published in Health Affairs that reported significant reductions in opioid deaths in states with PDMPs by, number one, helping to identify doctor shopping patients and or pill mill prescribers. And actually, when I mentioned to you that back when I was in Florida doing some of this, we actually developed some legislation around the doctor shopping. And the other part was any law enforcement that state boards are able to have access to now to catch any of these bad clinicians. And so moving back to you, Michelle, on the regulatory trends.
One of the challenges with PDMP today is that the PDMP data is not widely integrated into the EHR workflow. We know 44 states require some prescriber PDMP access before prescribing. So the prescriber needs to navigate to the PDMP website, log in, search for the patient to view the PDMP data. What we're seeing is some resistance from the prescribers since this requirement and access to state PDMP is not part of the workflow. Many states are working to address this issue by amending statutes that prevent data sharing with EHRs. Many states are encouraging integration into the prescriber workflow. For example, we know at least one state has specified EHRs build an interface to the PDMP by 1/1/21. A couple of states are enforcing the review of the PDMP data by requiring the prescriber to document viewing of the PDMP in the EHR. So let's move along to electronic prior authorization. Many states have enacted PA reform to make this process more efficient and less burdensome for the prescribing of prescription drugs. We have 14 states that have mandated EPA support by payers, while 15 states have passed legislation that allows for EPA but does not mandate it. The need for EPA is growing because more and more drugs, such as specialty medications, have PA requirements. You can read in the news and know prior authorization is a pain point for prescribers, so we expect to see more prescriber demand for EPA to grow. It certainly makes sense for EPA to be fully integrated into the EHR workflow with access to EHR data. But as we've seen with EPCS, which was approved almost 10 years ago, adoption will be slow. Many states allow for EPA, but again, only 14 mandate it for electronic prior authorization. One trend we are seeing now is medical EPA. Medical EPA is a new area that we've started tracking. Some of the challenges we're observing at this time is that we're seeing minimal standards and really kind of lack of clarity. We keep asking ourselves, is this about health services or drugs covered under the medical benefit? We're still trying to sort this out. And for those of you who subscribe to our EPA solution, this is something we expect to see more activity on. Right now, the laws are focused on requiring the payer to be ready to accept electronic prior auth requests. But as we said, like EPCS, over time, we expect to see a shift to the prescriber mandates. Derek, take us through the timeline of electronic prescribing and more specifically, EPCS mandates.
Good. Thank you, Michelle. I'll do that. This roadmap right here gives us kind of a timeline of the mandatory e-prescribing rules. So 18 states have laws that are passed but not yet in effect. Now we expect a few more of these laws to pass in various states later on this quarter before the end of the year. New Jersey, which I happen to live right now, is kind of an interesting one. As of May 1, the state is not only requiring EPCS, but is also holding EHRs responsible for supporting electronic prescription of controlled substances if they do business in the state. Let me repeat that. New Jersey is requiring that it's mandatory ePCS and holding EHRs responsible for supporting that ePCS if they do business in the state of New Jersey. That's pretty strong. And later this year, Pennsylvania has mandated ePCS requirements, and that's coming up next month in October. And then in the beginning of 2020, 6 states kick in for controlled substances, and in Iowa and in Florida, that is for all prescriptions. Then in July of 2020, middle of next year, Virginia, their ePCS law becomes effective. Moving on into 2021, in January, the HR 6 mandates for us, they will begin, ePCS will begin. And then in July 2021, 2 more states become effective. Lastly, California requires ePrescribing for all prescriptions as of January of 2022. That's the timeline, Michelle. Each of these trends that we've talked about has an implication in the EHR. One thing that hasn't been mentioned yet is the CMS required update to the NCPDP script version 2017-0701, and that is as of January 1st, 2020. Because this new version of the standard has many new fields and it offers a lot of improvements now to the existing transactions, this switchover does require some heavy lifting. You know, hopefully at this point, if not most, but all the EHRs have begun work on that so they can make these changes and get them rolled out to customers. So mandated ePCS won't have a feature function impact since most EHRs already support that. But vendors should be prepared for the influx of prescribers enrolling and getting credentialed for ePCS in time for that deadline. So here's an example. In New York, less than 20% of prescribers used ePCS prior to the mandate, but at the end of the first 6 months, more than 80% had signed up. So inclusion of PDMP in the EHR workflow is another big one because prescribers are being required to look at the PDMP data before writing opioid prescriptions. So again, you can see strong consideration should be given to integrate PDMP into the workflow. Now, with so many medications requiring prior authorizations, providers are looking for a way to reduce the impact of filling out all these forms, and EPA can help with that. So it makes a lot of sense to get ahead of the CMS mandatory requirement as of January 2021, year and a half or year and a few months, by integrating some of this electronic prior auth sooner rather than later. Now, there are a couple of other transactions on the rise that we see, like real-time pharmacy benefit check, and that's considered to be the backbone on the focus of price transparency. RxChange and RxFill were mandated by the most recent meaningful use EHR certification, but there really hasn't been a requirement for pharmacies or providers to use them. These can be very valuable transactions, by the way, from a patient safety perspective. So POCP thinks it makes a lot of sense to incorporate them into the ePrescribing workflow. And with that, I think we're up for another poll question, Melissa.
So this next question is, would your organization be affected if existing exemptions to non-acute care settings such as long-term post-acute care were rescinded? So one of the things that we were kind of hearing on the street, if you will, is that CMS specifically is looking on potentially removing some of those exemptions or not including exemptions for this area as much as they had in the past. There's a feeling that LTPAC environment should be up to date and be able to adhere to these policies now. So that's just something we've heard on the street, and it looks like about 63% of you would be affected if those exemptions were rescinded. So that's good to know. Michelle, why don't you tell us about the exemptions or regulations in the LTPAC setting?
Thanks, Melissa. In response to client requests, the POCP LTPAC State Navigator was launched, and it's an add-on service to our standard law review. We call out specific LTPAC exceptions and exemptions to laws and regulations we have reviewed. Practitioners in the long-term care, post-care environment have a unique set of requirements in these care settings and must understand their compliance with PDMP, EPCS, CS limitations, and other areas, all desiring these requirements to be addressed by their vendor software. For example, some states do not require controlled substance prescriptions for residents of nursing homes to be reported to the PDMP, let alone the need for the prescriber to query the PDMP prior to prescribing these drugs, since these patients are in a controlled environment and managed differently than ambulatory patients. For example, Wyoming contains a PDMP exemption in this area due to the inclusion of the inpatient definition applicable to their PDMP reporting laws. Similarly, we found that hospice patients and those with terminal illnesses also have relaxed rules on prescribing and dispensing opioid quantities and partial fills. Several states, Colorado specifically, exempts hospice care setting from their 7-day opioid quantity limit. EPCS can be also exempted in some states in this market. North Carolina exempts nursing homes, hospice, and residential care facilities from the mandated EPCS of C2 opioids. Then there can be different rules by state on who can receive an order from a prescriber for an LTC facility. Finally, as with other areas covered today, PSCP actively monitors and participates in various standard work groups like NCPDP that define the technical capabilities that permit prescribers and pharmacists and payers to talk the same language to address the business and regulatory needs of LTPAC vendors and practitioners. So Derek, what can you tell us about the future?
Well, what is next? Well, I hope what's next is that the next mega ball multi-million-dollar, it will hold the numbers I have correctly. But from this perspective, as you might understand, that there's going to be a continuing, ongoing swirl of legislation, both state and federal. More on the ePrescribing and EPA mandates. We're going to see stronger prescription drug monitoring programs and mandated utilization, more restrictions on opioid prescriptions, as well as opioid and benzodiazepine co-administration. From an interoperability standpoint, Michelle, we're again more PDMP, real-time benefit inquiry will be on the uptake. The 30-day MedRec, which is one of the use cases that came out of the HL7 Da Vinci project, and some more medical reconciliation and transitions of care. And we have a couple of customers that have already asked us to delve deeper into that, as a matter of fact. More is specialty medication prescribing increases, the ePrior authorization will get more traction, and some of the things that we see trending is AI, ePrescribing in long-term care and post-acute care, again, which we fleshed out our law review to include that in a separate document, and some things around privacy and security. That's what we see coming.
As we wrap up, please make sure you submit your questions to us using the question section of your webinar control panel. Before we get to the Q&A, I want to review a few key points. Monitoring state regulations and federal laws is becoming more and more challenging and complex. The volume of activity can be quite daunting. The regulatory environment is changing all the time, and anticipating these changes will allow planning for the EHR vendor. Supporting state regulatory requirements is important for EHRs. The prescribers are looking for their vendors to maintain systems that are relevant for their local setting and state. Staying on top of these regulatory issues will lead to greater success in meeting client needs. Lastly, we believe states will continue to legislate in unique ways, so EHRs need a way to anticipate these changes and plan accordingly. Product managers can track laws and rules themselves, or they can leverage outside services such as POCP's ePrescribing state law review, which also includes our expert guidance along with our rules and regulations summarized in an easy-to-use format for EHR product managers. When I was a product manager, I tried managing the law review with our legal team, but soon realized we couldn't stay up on all the different aspects of the changing EHR environment. We were spending a large part of our work week just staying on top of these regulations. This monitoring was taking me away from my product planning and was expensive use of resources to our company, and I really knew I had to make a change. I then became a subscriber to the POCP Law Review. The beauty of the Law Review is that the POCP team distilled down the information that was understandable and actionable for me. It was a very valuable tool for me to help plan our product map and prevented me from missing key regulations and rules. Derek, what types of solutions does the Regulatory Research Center offer?
Thanks, Michelle. Well, the four main parts of some solutions that we offer, and we try to fit this to anyone who has a need for this, is the ePrescribing State Law Review, the State Navigator, the EPA State Navigator, the LT-PAC State Navigator, and then we do a state law review that's on demand. So we offer these clients regular updates and consulting hours as part of our subscription solutions. And we don't think that there is another product or solution out there like that. So not only do you get a subscription service that's an annual service and you get quarterly updates, but in between the quarterly updates, there's two different forms that you would get. A is that you'd get a monthly summary as to what was going on that particular month. And then if there's anything like Ohio is notorious for doing, and or California did, and we caught this, and we alerted our customers right away when we saw this, we call them sentinel alerts. And that means something, a big red flag has popped up and that everyone needs to know about it right now, ASAP. And we're able to do that. In addition to that, just like I mentioned a little while ago on the MedRec side, is that we're able to customize and modify some of these things to be a little more specific to a customer that might have a particular interest in a certain area that we can help out with. I'm not promising we can help out with all of them, but we can help out with a bunch of them, and that's what we've been able to do. So, and one thing I want to make sure everyone is aware of is that we recently completed a very comprehensive report on electronic prior authorization. That's available also for purchase. So we have a number of solutions. We think it's the most up-to-date. The information is not stale. It's not old like we have seen in some other potential solutions out there. And the ability to call in and speak directly to you, Michelle, or to Keith, or some of our other team of experts, I just don't know how much better it could get than that. So just so everyone knows, you can find out about these products a little more in depth at our website, pocp.com/regulatory resource center, and or send me any kind of questions you might have, or any one of the team members on the Regulatory Resource Center. So, and again, we're wrapping this up. Thank you guys for all spending some time with us. Michelle, do you have any last thoughts?
I just want to thank everyone for attending today. We hope the information we provided to you has been helpful.
I also wanted to mention that we're offering a discounted rate for the first year of subscription services to anyone who registered for the webinar today. So please reach out to Derek or myself with questions about that. If you want to know more information or set up a demonstration, we can kind of dig into the details of what's in the law review, what's in the additional information that's in LT-PAC and the EPA State Navigator as well. We'd be happy to set that up. If you have questions that come up to your mind later on, again, feel free to reach out to us and we'd be happy to answer them offline. Thanks again and have a great rest of your day.
Thanks, everyone.